Welcome to Bright Health podcast. My name is Dr. Ali Day. In today's episode, we would like to discuss about traditional or Western medicine and functional medicine. In Western medicine, when patients arrive at me in my practice, I get all the necessary history, past medical history. I might arrange some laboratory data and radiology result, and based on those information I arrive at a diagnosis. And when I find a diagnosis, then I have to formulate the treatment for the patient. For example, if the patient has blood pressure, I have to find a medication that reduces the blood pressure and normalize the blood pressure of the patient. And in these circumstances, the aim of the treatment is not to reverse this problem. Is you are not going to cure the problem. We just find the problem, and based on our training in a school years, we find, oh, this is the pharmaceutical intervention or surgery or any radiology treatment that helps to improve or mask the symptoms. So it's not going to reverse completely the condition. In contrast to Western medicine, in functional medicine, the approach is very different. It's a kind of a root cause medicine, and we try to figure out why this is happening and how we can improve or completely cure this condition. So that's how the functional medicine shines. When I want to explain this in more detail to my patient, I usually show them I give them a kind of an analogy of a tree. That if a tree is not giving you the nice fruit, is not green, is not growing, the branches are dying, instead of going and spraying the tree that we do in a Western medicine or doing some focal treatment, I go to the root of that tree. And if somebody by the name of Ali is putting bad chemicals into the root of that tree, I would ask him, hey Ali, stop putting the bad chemicals or bleach or anything in that region. And then I focus on the soil of that tree to make that soil rich. I add fertilizer, compost, chicken poop, cow poop, water. So make that soil rich, and lo and behold, that tree start to grow. And that needs patience as well. It's not going to happen overnight. So I have to do this over and over again and sit back. 6 months later, 1 year later, the tree start to go green, lush, give me the nice fruit. So this is the difference between functional medicine and traditional medicine in this area. In the example that I mentioned to you earlier about the blood pressure, for example, in Western medicine, how I treat my patient, I have to give them medication anyhow, because if I don't give that, it has deleterious effects on the cardiovascular system. It's a silent killer. So we have to keep it low to help the patient. But the general advice to the patient is you should take this drug until the day you die. Because if you're not taking that, the blood pressure goes up. But we know that from functional medicine, and I always tell my patient about this fact that this condition is almost always can be improved or completely reversed based on what you are doing with your diet and your lifestyle. We look at a lot of things when we would like to come and help the patient in the region of, for example, blood pressure. I do a lot of blood tests that I look at the nutritional status of the patient, namely zinc, a specific type of magnesium, vitamin D, the most important biomarker is fasting insulin. And when the fasting insulin is elevated, that's a huge negative impact on the blood pressure. We discussed that later in what's the mechanism of effect. And by the way, that is completely overlooked by modern medicine, and I think it's gonna come gradually to the textbook in the next 10-15 years. So I do the blood test, I ask the patient's uh, exercise regimen, sleep quality and quantity, stress management. So there are so many ways we can help the patient to reduce their blood pressure in a natural way, and it almost always win in comparison with just pharmaceutical interventions. if if that's something that resonates with you, if you want to know more, please stay tuned. My name is Dr. Ali Day, and in this channel I would try to help my patient, empowers them to become the CEO of their health and improve their health in a natural way.